Hello again. I'm Richard Knight, President of the American Association of Kidney Patients. Thank you for joining us for the 47th Annual National Patient Meeting. As part of the AAKP initiated Decade of the Kidney, AAKP has purposefully targeted kidney research as a strategic priority for involvement and impact. Our national and global patient advocates and affiliates have been actively reaching out to all involved in the kidney science and research enterprise to offer their expertise and insights. At AAKP, we know that medical innovation and public policy are shaped by research, and without patients as active partners, future innovations in kidney disease and kidney disease care would not reflect our practical insights and lived experiences. Further, since research impacts public policy, including regulatory decisions and issues related to what new drugs and devices are paid for by government and private insurance, it is critical that patients work alongside research experts. Again, this is why you see so many messages from AAKP about opportunities to join a research project at a university through the federal government or PCORI. Our goal is to populate and impact every single kidney research project underway in the United States and across the globe. And as you will hear, we have been helped by research professionals in academia and government who want to work with you and AAKP. For today's session, Patient Consumers, Elevating and Including the Diverse Voices of Patients, I'm pleased to welcome several presenters whose work and personal commitment are for greater care choice and ending desperate health outcomes among communities who suffer the most from kidney disease. Now, I welcome Dr. Raquel Greer, Program Director for Kidney Health Equity at the Division of Kidney Urologic, Hematologic Diseases at the National Institutes of Health. Dr. Greer, we are honored to have you join us. Please take it away.
Thank you, Richard, and thank you for that wonderful introduction. Welcome, everyone. I am Raquel Greer, and I co-direct the Kidney Health Equity Program at NIDDK, the National Institute of Diabetes and Digestive and Kidney Diseases at the National Institutes of Health. And I'm honored to share with you several initiatives at NIDDK focused on advancing health equity among individuals living with kidney disease. The mission of NIDDK is to conduct and support medical research and research training and to disseminate science-based information on diseases within its mission to improve people's health and quality of life. This broad research responsibility includes some of the most common, debilitating, and costly conditions affecting Americans today, as well as the diseases with some of the most stark health disparities, one of which is kidney disease. Kidney disease is a significant public health problem with marked racial and ethnic disparities in health care and health outcomes. Racial and ethnic minority populations are more likely to have risk factors for kidney disease, such as diabetes and hypertension, experience more rapid progression from chronic kidney disease to kidney failure, and have lower rates of optimal kidney replacement treatments, such as home dialysis and kidney transplantation. The NIDDK is committed to eliminating these inequities and advancing health equity for individuals living with kidney disease. However, to eliminate these inequities, we need to move beyond research that simply describes these inequities towards research to develop, implement, and evaluate interventions that address the social determinants of health and the upstream unjust systems, policies, and laws that generate and perpetuate these inequitable social conditions, such as food and housing insecurity and lack of access to high-quality healthcare that contribute to the long-standing inequities in the care and outcomes among marginalized populations living with kidney disease. NIH and NIDDK have several ongoing initiatives that aim to promote equity within our workforce and in our research. And I'm going to begin by highlighting several of our organizational efforts to promote equity. As part of the NIH Unite initiative and NIDDK's IDEA-C program, we have worked to implement interventions to begin to identify and address structural and institutional racism within our systems, policies, practices, and culture that may contribute to the lack of diversity, equity, and inclusion within NIDDK, NIH, and the greater scientific community. These efforts have included developing a racial and ethnic equity plan that consists of structural racism and equity training for our leaders and staff to enhance their understanding of structural racism and its impact on health, biomedical research, and the NIDDK workforce so that they can more actively work to address it. We are also working towards identifying and dismantling any racial and ethnic disparities in the Institute's workforce, as well as enhancing research workforce diversity. One example of these efforts is NIDDK's Race Ahead program for NIDDK staff at all levels, including senior leadership. It's an intensive program that provides participants with tools and a professional network to advance equity, diversity, inclusion, and accessibility at NIDDK. They work together as a group to engage in those difficult conversations and the hard work needed to develop action plans to enhance racial and ethnic equity at NIDDK and hold each other accountable to implement those plans. These efforts also include a commitment towards growing our health equity and health disparities research portfolio. The NIDDK developed a strategic plan for research with extensive input from leading researchers and patient advocates from across the country. And the overarching theme of the strategic plan is to empower a multidisciplinary research community, engage diverse stakeholders, and leverage discoveries of connections among diseases across NIDDK's mission to improve prevention, treatment, and health equity, pursuing pathways to health for all. This graphic of the strategic plan illustrates the four major scientific goals represented by the hexagons and the cross-cutting themes which are represented by the circles. A cross-cutting theme throughout the strategic plan that is crucial to NIDDK's mission is achieving health equity by eliminating health disparities among racial and ethnic minority populations and others who are underserved. NIDDK has established a health disparity, health equity research work group of external researchers from across the country with expertise in health disparities and health equity research, patients, and community members to help us develop a plan for implementing this research goal. And over the past year, the group has been hard at work to identify a range of research opportunities and actionable recommendations addressing high priority NIDDK research needs on health disparities and health equity. And they're also working to identify opportunities to strategically implement those recommendations to enhance and advance health disparities and health equity research within our mission. I've included some of those subgroup topics that were discussed in the box in blue on the right that focuses on engaging communities and building sustainable partnerships, understanding social determinants of health effects, the biology of health and disease, so understanding how those exposures get under our skin, identifying interventions to address social determinants of health, as well as addressing upstream causes of social determinants of health and health disparities. And it also focuses on listening to community perspectives on the needed areas of research to address health disparities. This report is currently being drafted and should be available by December for public comment. And we encourage you to take a look at it, review it when it becomes available, and to provide your input. We are already moving this area of research forward, and I'd like to use my last several minutes to highlight some of the exciting new research initiatives in this area. The first initiative is the System Interventions to Achieve Early and Equitable Transplant Study, or STEPS, led by Dr. Ebony Boulware, and it's funded by both NIDDK and PCORI. The study aims to test whether STEPS, health system surveillance and outreach interventions, overcome the critical roadblocks contributing to racial disparities in kidney transplantation and live donor kidney transplantation and underutilization of these treatment outcomes. The study includes adults with advanced kidney disease or who are at high risk of progression to kidney failure from 3 health systems in the southeast region of the U.S., including Duke, University of Mississippi, and Geisinger. Participants are randomized to either receive the STEPS intervention or augmented usual care. And the STEPS health system intervention includes a registry to identify potential candidates for preemptive or early live donor kidney transplantation. And it also includes transplant social worker and coordinators who are embedded within transplant teams to reach out to potential candidates to provide targeted education and counseling, and to address any barriers they may be facing in pursuing transplantation and navigating the evaluation process. And the study will assess whether or not this intervention is effective in impacting key outcomes, including increasing rates of completion of transplant evaluation overall and among Black participants and those living in rural areas. Another key initiative that I'd like to bring to your attention has focused on the need for interventional research addressing kidney health disparities. And we hosted a workshop very similar to the STEP study. And we hosted a workshop this past February to discuss designing interventions that address structural racism to reduce kidney health disparities, recognizing that structural racism is the fundamental cause of many of the health inequities we see in care and outcomes of individuals living with kidney disease. And the goal of the workshop was to bring together experts, people living with kidney disease, community members, and other key stakeholders to identify actionable research trial questions for interventional research in this area. And Dr. Keith Norris and Dr. Katina Lang-Lindsay will share in a later talk some of the key findings from this workshop. What I'd like to share is that this workshop informed the development of new funding opportunity announcements for interventions to address structural racism to reduce kidney health disparities. These funding opportunities are supported by NIDDK, as well as the National Institute on Minority Health and Health Disparities, the National Institute of Nursing Research, and the Office of Disease Prevention. These funding opportunity announcements aim to support a consortium comprised of a research coordinating center and up to 6 intervention sites working collaboratively to achieve 2 main goals. The first goal is to design and conduct community-engaged clinical trials to test novel interventions that dismantle or mitigate the effects of structural racism that contribute to kidney health disparities. Recognizing that authentic engagement and partnerships with people living with kidney disease and community members are essential for this work. The second goal is to foster research collaborations between investigators, people living with kidney disease, community-based organizations, and other key stakeholders, and really helping to build a community of people with skills to develop, implement, and disseminate effective, scalable, and sustainable interventions that address the structural drivers of kidney health disparities. Another initiative I'd like to share with you is the Community Partnership to Advance Science for Society, or COMPASS. COMPASS is an NIH-wide initiative that aims to develop, share, and evaluate community-led health equity structural interventions that leverage partnerships across multiple sectors to reduce health disparities, and to develop new health equity research model for community-led, multi-sectoral structural intervention research across NIH and other federal agencies. The COMPASS program provides an unprecedented opportunity to design innovative intervention projects that focus on social determinants of health and community-empowered research. In this funding opportunity, what's unique about it is that community-based organizations apply and receive the funding to do this work in partnerships with research organizations. And the program really works to facilitate communities and researchers working collaboratively as equal partners in all phases of the research project, and also aims to fund structural interventions that go beyond changing health behaviors for individual participants to interventions that aim to change the social, physical, economic, and political environments that shape or constrain health behaviors and outcomes. And these last 2 initiatives really highlight the NIH's and NIDDK's recognition of the importance and commitment to promoting community-engaged research. I want to close by restating that NIDDK is committed to reducing and eliminating health disparities and advancing health equity. We recognize as a key funder for kidney research, we have a responsibility to support advancing health equity research. These initiatives are just a few examples of the many steps NIDDK is taking towards achieving that goal. Both Jenna Norton and I co-direct the Kidney Health Equity Program, and we invite you to reach out to us with any suggestions or questions you may have in helping to advance this area of work. Thank you.
Thank you, Dr. Greer.